basics, a lot of people call it lonely disease. Basics like very common disease for like diabetics. So this is the basics, the
It's as common as diabetes.
Exactly.
Okay.
A lot of people, it's very common. And however, this awareness is the problem. And endometriosis basically is you think about it's very complicated disease, but however, it's the very simple basic theories. So it's the cells like similar to lining of uterine cavity in other organs, like in the bowel we call bowel endometriosis, in ovary we call ovarian endometriosis, and in somewhere else we call like liver endometriosis.
About how many women do you think have endometriosis?
So based on the literature, so now quoted incident is as common as 1 in 9 women have endometriosis. It's very common.
Yeah, that is really common.
Yeah.
What are the symptoms that those women experience?
So endometriosis has various symptoms. So it's kind of depends which organ you have endometriosis. If you go to like a GI, you have bowel symptoms like painful bowel movements, or sometimes can have a bloating, or you have on the uterine walls, then causing basically we call painful periods. Then on the ovary, it can cause ovarian cyst, can cause the pain, and even in the bladder, it can cause like urgency or sometimes bloody urination. So there's various symptoms. It's not specific. You can chase to.
It leads to infertility in women too, right? Weight
Yes.
gain, things like that.
Yeah, you can cause weight gain. 50% of infertility patients because of endometriosis.
50%.
Yes.
Oh, and we know that a lot of couples struggle with infertility too. So that you think that's the cause in 50%?
Yes.
Oh, geez.
And
So this can be really devastating for a woman too. As common as it is, it can lead to a lot of complications in their life.
yes. Yes, so as we just mentioned before, if endometriosis involves different organs, you see if involve bowel, it can cause a lot of bowel resection. We have patients have to do a bowel resection. We have patients have big endometriosis nodule on the liver, so we have to remove it there. And we have patient endometriosis on the lung. You have to do the lumpectomy to remove the lung, part of lung, so to solve the problem. So,
Sorry.
go ahead.
Well, on Saturday, when you guys are doing the panel, you're specifically focusing on women and gynecological endometriosis, correct?
Yes.
Okay, yeah. Can you tell me do you know the details about Saturday? Like, what are you're gonna be airing a documentary, and tell me a little bit about it?
Yeah, so it's very powerful. This is basic. This documentary event bring the endometriosis to the mainstream. Now it's everywhere go to have endometriosis. This event really great for the patient to understand, to know, because this includes 2 parts. One part is about the patient. There's 4 patients to share their stories, how they fighting, battling the endometriosis through their stories. Then there's a 1-hour panel discussion from multiple disciplinary team. We have from the Baylor, basically. So we're going to have a psychiatrist, basic science research, have physical therapy, and our minimal invasive team. We're going to go together to give the information and discussion about endometriosis and with the patients.
As common as it is, I don't feel like a lot of women still understand it or know about it.
Yeah, so this is a big issue, and however now March is the Endometriosis Awareness Month. This is great information we can offer to the patient through this like an event or this like kind of documentary. And so this hopefully after this event can promote the disease awareness. And that's another great news for us is the Houston of City Hall going to light up the basics the building, and for the yellow color. Everyone knows yellow color stands for endometriosis. In basics, in coming soon, after our event, it's on March 5th, 6th, 7th. Hopefully everyone be aware.
Yeah, absolutely. Yeah, I'll take a look. I'll look at City Hall for that. That's good information to have. What about the treatments for endometriosis? I mean, obviously that's your specialty, right? Like,
Yes.
what are the options for women to get treated?
So endometriosis treatment is we call endometriosis complex disease. Why is complex? The basic treatment is complex too. So there's a medical treatment and a surgical treatment. So we involve many of surgical treatment for endometriosis. The key of surgical treatment for endometriosis is complete removal of endometriosis. We have many basic disease endometriosis because of underdiagnosis, or they not recognize the disease. Then they lead to inadequate treatment, which means they do not completely remove endometriosis. So this is the treatment. Now after treatment, normally have a kind of pain management treatment, and the other one is the hormonal treatment to decrease the chance of endometriosis coming back. And there's many patients after endometriosis surgery, they can able to get pregnant after surgery.
Good. Does the hormones, you use hormone treatment because does hormones kind of fuel it to progress?
Yeah, so hormone treatment basically is we call progesterone, like it, or we just shut down the periods. So basically it's all the hormones shut off. For endometriosis, because estrogen is the nutrition for endometriosis, that's why we try to block this like a chain of food for endometriosis. So we give a hormone like progesterone or leuprone to shut off these estrogens, so decrease the endometriosis coming back.
Well, that makes sense if somebody's using that type of treatment too, that they wouldn't be able to get pregnant, right?
Yeah, so this is the treatment, not the people or patients seeking for.
If somebody wanted to
get pregnant.
Yeah, if somebody wanted to do that, then they have to kind of opt for the surgery.
Yes.
Yeah, okay. What's the recovery for the surgery like?
So normally, because we are minimal invasive surgery, we have a robotic surgery. We have a big division in Texas Children's Hospital. We have 2 robots now. All the surgeries go through a minimal invasive surgery as robotic surgery. So normally a patient can go home same day. But however, patient going to have little bit pain for a couple of days, then back to normal. Normally 6 weeks can back to normal activity.
Okay. Very good. What else do you think that people need to know about endometriosis?
So I think this is awareness of endometriosis is the key for successful treatment. If you not realize your family or your loved one have endometriosis, this is not lead to you seeking for expertise care. So this is the key component of this event. So hopefully everyone, I think everyone knows someone have endometriosis,
right.
Either your family, your friend. So hopefully you're going to support your family member or your loved one to seek for expert care. So that way can reduce the painful for patient. And another one is there's a very, very big information for this, why we have this March for Endometriosis Month, because less 10 years delay, 10 years. It's not 1 year, 10 years delay to diagnosis endometriosis. So that's why all these women suffer for 10 years painful periods and painful everywhere. So for 10 years, then get a diagnosis and treat it. So if you can shorten this 10 years to 1 year or right away, that'd be great benefit. And also going to bring down the cost. That's a basic 119 billion weight loss because of endometriosis in U.S.
That's interesting. I'm sorry, I know you have the.
Yeah, it's fine.
So I guess my last question is, why does it take so long for women to get diagnosed? Is it because are the early symptoms subtle? I know you mentioned bloating and discomfort, and so that can be, categorized as other things, right?
Yeah. So there's 3 reasons. One is the patient not realize, not seeking. Like when patient normally talk to mom, right? Mom have a pain during the period. Mom said, I have too, so don't worry. So they take it from inherited from the parents. Say, oh, this is normal, painful period, it's fine. This is fine with patient wellness. You're not seeking for medical care, so health care. So the second one is because of when you go to the provider, then provider not recognize this. From most people go to the family practice physician or general OBGYN because they not recognize this is the endometriosis-related symptoms. Then this is the second one. Then when about these symptoms, the third one is that this symptom is not specific. So because it involves organ, it gives different, like generalized symptoms. I have pain, I have bloating, I have a painful period. So this is like not the specific. That's why delay the diagnosis. Then third one is some of physician provider go to do the surgery. They not recognize atypical endometriosis. They ignore it. This happens very common when I go to do the surgery. And a lot of patients have surgery with other physicians. They say, oh, there's no endometriosis in your pelvis.
Really?
So they came to me, we see everywhere. But because this is atypical, that's why education for we have basically in our division, we educate the medical students, we educate the residents and fellows to diagnose the endometriosis, basically. So this is a key. When you have diagnosis, then you can treat the patient.
I can't believe that somebody could go through another surgery and they didn't see that.
Yes.
That's incredible.
Yeah, we have patient, the mass surgical patient have like 15 surgery done before.
Oh, no.
They came to me.
Oh, no.
Yeah.
That's terrible.
Yeah, it's crazy.
That is crazy.
Yes.
Yeah. Wow. Okay, well, I've learned a lot. I don't think I have any other questions. Is there anything else that you'd like to add?
Yeah, so we just hope everyone through this medical news, TV news, everyone come to TCH. We have the full division, minimal invasive division. We locate in the 3rd floor, and we support by Texas Children's Hospital and our university, Baylor College of Medicine. You can get all the information here, and you're going to get the best care and the fast care because we have multiple disciplinary teams. We have psychiatrists, we have a colorectal surgeon, we have a urologist, we have a physical therapist, we have menopause center, we have a Euro guy. They all support in the same team to taking care of this complex disease. And hopefully welcome you guys come to our clinics.
Yeah, and hopefully people can just come out on Saturday too and get more information about it, all of that.
Yeah, welcome to Saturday, our
Excellent.
event.
Yeah, okay, great. Thank you so much.
Thank you so much.
I know you've